What is a crazy medical fact that most people don't know about? Story one. When you get a kidney transplant, they don't take out your original kidneys. So you have three kidneys after a transplant. Also, they transplant the new kidney into your abdomen, and it sits on top of your pelvis and hip area. If you get multiple transplants, they just keep adding new kidneys in. I've known of patients who've had six kidneys. I learned a lot about this during my kidney transplant 6 years ago. Story two. It's impressively hard to close someone's eyes after they die. Not like on TV. You press them down and then they open back up a little. Then you have to press them closed again and press a little harder. I know. I was at my bedside when my dad passed away. If he was still in the room, I bet he had a good chuckle. Miss him. You just reminded me of the memory of when my grandfather, who was like a father to me, died. It was me, my mom, and my aunt all around him at 5 a.m., and I got to hold his hand from 10 p.m. to then. He suddenly became lucid, said, "Oh, wow," and passed away while looking at us. It was very sweet and was a good way to go, which makes it mortifying that I said to my mom and aunt 2 minutes after, tears still pouring from our eyes, "We should probably leave the room. People sometimes defecate when they die." It weirdly became a good memory for all three of us. And I think my jokester grandfather probably thought it was hilarious. If it's true, the brain is still active minutes after the heart stops. Story 3. I had a total thyroidectomy last year due to thyroid cancer. I learned that in rare cases, your body can regrow thyroid tissue, maybe healthy and functioning, maybe not, from the very small number of thyroid cells left behind. It's the reason thyroid cancer patients need to be on a high dose of replacement hormone to suppress the production of thyroid stimulating hormone that could trigger regrowth. It was wild to learn that removing the gland doesn't always solve the issue. I have thyroid cancer and had a total thyroidectomy about 3 years ago. I still get regular labs done and ultrasounds every 6 months. Last year, they found a bunch of thyroid tissue had started growing on several of the lymph nodes on the left side of my neck, stretching from my ear to under my collarbone. I have another scan coming up, and now every time I'm terrified they will find more. Story 4. Pneumothorax, collapsed lung, can just happen. If you sneeze or cough or just breathe wrong, your lungs can nope and collapse. Your lungs are very loosely glued to your chest walls by a layer of mucus. If air gets out of your lungs and into that space between the lung and your skin, the pressure will force your lung to collapse. This can happen for many reasons. Sometimes your lung can just rupture because it had a bad day. Anything under 80% capacity loss can usually fix itself. The air in your chest cavity is absorbed back into the body. Anything more than 20% is a problem. Infection and death would be the next steps without medical intervention. Happened to me, my left lung collapsed to 20% capacity. They reinflated it. 2 weeks later, it happened again. Pleurodesis is when they mess up your lung and skin with medical grade lye powder, and then stick the two together. The resulting damaged tissue heals into one solid piece, so even if there is a rupture, the lung cannot be forced down. The left side of my back was numb for nearly 10 years because all the nerves in the skin were toasted by the chemical powder. Story 5. Your immune system can just decide to attack whatever. It can decide that your hair follicles are a deadly threat and make you bald. It can go after your spinal cord and make it so your legs feel like they're on fire 24/7. It can attack your organs and cause damage severe enough to necessitate a transplant. It can eat holes in your brain. It can tear up your joints. You can even wake up blind because your eyes were on your immune system's hit list for today. I think people are aware of autoimmune conditions, but I think most people don't think about how much can go wrong. Story 6. Things I learned from my doctors and my own reading after I found out I was having twins. At age 35, a woman's odds of having a multiple pregnancy drastically increases, and it continues to increase each year. This is due to your body's response to preparing for menopause by releasing more than one egg at a time. The older you are when you get pregnant, premenopause, the more likely you could have a multiple pregnancy. You are likely to be the most fertile right before you begin menopause. Ever hear of a change of life baby? If you already have had a multiple pregnancy, your odds of another one greatly increases. People frequently ask, do twins run in your family? Fraternal twins, two fertilized eggs, are the only genetic twins. Women get the gene to release more than one egg through their mother and her mother and her mother. Identical twins, one egg that splits, is random in nature and can happen at any time. African American women are the most likely to have twins over any other race. Caucasian women over 35 have the highest rates of triplet or more pregnancies in the USA. If you have a higher BMI, 30 plus, you're more likely to have a multiple pregnancy. Story 7. A lot of bone breaks don't hurt that much. I work in radiology, and while we don't see the nasty breaks you do in trauma, which often really hurt, we see a lot of broken toes, fingers, metacarpals, and metatarsals. Those breaks are often not easy to distinguish from muscle or tendon strain without imaging, and the patient is acting completely normal. I used to think breaking anything would have someone on the floor in agony, but a lot of them are like, yeah, it hurts when I bend it. If you want nightmare fuel, sometimes your spine can spontaneously break under its own weight. This is called a compression fracture. Story 8. Maybe not that commonly unknown, but in movies and TV medical emergencies, you always hear the doctor or medics yell, "He's flatlining, get the paddles," and then proceed to shock the patient. You actually do not shock, flatline. You shock fibrillations. Heart is beating but not pumping blood because it's a chaotic rhythm. You actually shock the heart to flatline. It's the human equivalent of turning you off and back on again. This is a very simplified description, but you probably don't want the crazy explanation with all the exceptions to the rules and such. Story 9. Everyone knows that if you feel a lump in your breast, you gotta get that crap checked out. But there are actually 12 symptoms of breast cancer. The SOW image on this site, an entirely woman run nonprofit, literally saved my life. My doc did a physical exam, didn't feel a lump, and tried to send me packing, dismissing the weird, allergic reaction looking patch of skin on my chest. Any change in your chest, dimples, dents, skin texture, itching, dry skin, anything run by your doctor and trust your gut. In my year of treatment and monthly checkups for the last few years, I always make a point to ask one nurse or doctor if they know there are 12 symptoms and they don't know. Point being, not that docs suck. There's a lot to learn. Women's health is secondary in med school, etc. But that you have to dial in and fight for yourself. Story 10. Weight loss surgery cures diabetes. I'm talking about type 2 diabetes, and not from weight loss. It happens almost immediately. Somehow it perturbs the gut flora, and that's what causes diabetes, maybe. The Nobel Prize in 2006 was given to a research doctor who theorized it was bacteria, not stomach acid and stress that caused ulcers. Unable to get funding for research, he drank an H. pylori milkshake and gave himself ulcers. He was Australian because of course he was. Fecal transplants have been known to cure Crohn's disease, but have also been found to transmit clinical depression from donor to recipient. All this is to say, we don't know all about the gut. Story 11. I suffered from endo for over a decade, all the while being told my horrific bleeding, lasting months, and agonizing pain. I am talking 10 out of 10 on the pain scale at times and literally screaming in agony, was normal, and that you don't have endometriosis. I quite literally could not leave the house 95% of days. I couldn't work. I missed all kinds of things, like seeing friends or going to family reunions or weddings, and even just daily stuff everyone else takes for granted. I fought so long and so hard for a hysterectomy because nothing else worked, and when I finally got that surgery, the surgeons were all, "Oh wow, you had stage 4 endometriosis." The least surprising thing to me, after being dismissed as overreacting for over a decade of my life being stolen by it. It destroyed my health and how fit I used to be. Endo is awful. It is real. It can ruin your life and every single aspect of your health, all while medical professionals brush you off. Story 12. Roughly half of the world's population is iron deficient, of whom about half have iron deficiency anemia. Iron affects literally every part of your body, from how cold your feet are to whether you exhibit symptoms of bipolar disorder. Seriously, consider looking into it if you have any unexplained symptoms. If you have restless leg syndrome, get a blood test for ferritin now. A level of 100 is recommended, but doctors will sometimes say that as little as 40 is fine. Edit, which the published sources I've encountered disagree with. In any case, there's no harm in increasing your ferritin to 100. Story 13. During the COVID outbreak, when the mask versus anti-maskers clashed, a similar situation happened during the Spanish flu outbreak during World War I. There were as many people in government pushing for masks and vaccines, a proto-version of what we have, as many were against it. It didn't help that both sides of World War I lied and modified their numbers so that their opponents wouldn't see as weakness exploited. The only country that was open of its numbers was Spain, as it was fighting a civil war. Due to Spain accurately reporting its numbers, Both sides of World War II pinned the blame of the flu on Spain as their numbers were reportedly larger than the other countries, causing war. Thus, obviously, the flu had to have originated from there. Most don't know it originated from the United States. Story 14. I think we take for granted that we're constantly teetering on the edge of not surviving. You have a few minutes of oxygen in your body. Your life up to now has required hundreds of thousands of hours of routine heart beating and breathing to not die. It's not something you can be good at just 99.9% of the time. Your brain is the most complex thing in the known universe, but it still is only a few minutes away from death if it doesn't get oxygen. Right now, take a deep breath in and feel your heartbeat. If either stops happening, that clock starts ticking and it's all over. The pituitary is cool and has some neat tricks up its sleeve. Your gut and microbiome are crazy. But that's all irrelevant if your brain misses out on a few minutes of oxygen. We can make iPhones and stream live video from the space station, but all of us have a countdown timer that could start at any second. That system is so simple and elegant, but also so terrifying. Story 15. Taking antibiotics can cause psychiatric symptoms. It's not common, but it's not rare either. If you are taking antibiotics and experience derealization or depersonalization, you need to stop immediately. The cause of this is not well understood, but it's generally thought to be something to do with serotonin. Gut microbes modulate about 60% of your serotonin so that you can use it, and antibiotics disrupt your microbiome severely. Curiously, patients with pre-existing psychiatric symptoms sometimes see improvement when they take antibiotics. Also, a lot of people in this thread are talking about fecal transplants, and I want to mention that those transplants are not easy. You have to nuke the existing biome to establish the transplant, which is very hard to do and very hard on the body. A lot of those transplants don't take, and even if they do, the body can revert back to its old microbiome and associated conditions due to the recipient's diet and location. Microbiomes do not exist in a vacuum. What you eat, where you live, who you hang out with, all of this influences what kind of microbes live inside you. So the fecal transplant, while promising, is still very much in its research phase and should not be thought of as some kind of simple miracle cure. Story 16. Many doctors don't believe that fibromyalgia, POTS, chronic fatigue, or chronic Lyme disease are real. Or should I say that most doctors know the patient's symptoms are real, but believe the symptoms have psychological origin rather than physiological? I don't know if chronic Lyme is real, but I know someone who's had debilitating chronic Lyme for over 20 years now who absolutely has some sort of psychosomatic problem. She's completely fine as long as she's doing what she wants to be doing, like training for American Ninja Warrior. But the second something is boring or uncomfortable or aversive in any way, she's suddenly stricken with a terrible flare up and unable to function. Fortunately for her, she's a trust fund baby and has and will never need to work. Lyme gave her the perfect excuse to avoid ever really trying in life. Story 17. That tumor markers in your blood work are no good for detecting some cancers, notably bowel cancer. Schedule a routine colonoscopy and listen to your body for symptoms. I received blood results that said no tumor markers, but then gave my doc a symptom list that had him send me for an immediate colonoscopy. I had stage 3 cancer. So, as it happens medically, some tumors do not show up in bloods. Listen to the body. Or better yet, once you hit 40, schedule a routine colonoscopy, as sometimes it's symptomless until it's way too late. Story 18. You can end up with too much or too little cerebral spinal fluid, and it's really hard for doctors to figure out that something's wrong with your CSF because it doesn't really show up on standard CTs or MRIs. And it's rare enough that most neurons don't think of it as a first-line issue. They also suck at it and use outdated or bad information in their diagnosis. Having optic nerve damage is a sign that CSF pressure is high, but not having optic nerve damage doesn't mean you are fine. It's unfortunately a common mistake, and there's potentially a lot of people misdiagnosed with chronic migraine who actually have a cerebral spinal fluid issue. The only actual test is a lumbar puncture to get the real pressure inside your head. Story 19. The modern world is far too loud. More and more people are developing permanent catastrophic tinnitus, ringing in the ears. There's a startling increase of cases in young people, probably because everyone wears headphones permanently these days. It's not uncommon to develop a mild form of tinnitus in old age. That can usually be tuned out or is otherwise mildly annoying. Unfortunately, people misunderstand that this describes all tinnitus. When I say catastrophic, I mean a jet engine wouldn't drown it out. The sounds people hear range from the typical flashbang noise to clicking typewriter noises to anything in between. It can also cause related issues like a thing called tonic tensor tympani syndrome, where your eardrum just randomly flutters for no reason. We have no idea why this happens. You have it for life. There is no cure. It cannot be treated. People kill themselves because of it. What's even weirder is that it isn't always hearing related. You can just wake up one morning with it despite having perfect hearing. Ultimately, it's a dysfunction in your brain similar to epilepsy. Story 20. I have two. One, men can get breast cancer. It's far less common than in women because they have less breast tissue, but it does happen. So, men, if you find a lump on your chest, please get it checked out. Two, there's a condition called familial adenomatous polyposis where you grow thousands of colon polyps at a very early age. Polyps are what lead to cancer, so people with this condition are almost guaranteed to develop cancer by their 40s. The polyps are basically everywhere, and they can even end up in the small intestine and stomach. The treatment? Removal of the entire colon and rectum. So please get your colonoscopies regularly. If this is found early enough in one patient, it allows their family members to be screened even younger, and even without crazy genetic disorders, it's still important to catch colon cancer early. Story 21. One fascinating and lesser known fact about vaccines is the story of the vaccine necklace. In the early 20th century, Albert Sabin, the scientist behind the oral polio vaccine, worked to make immunization widely accessible. The oral vaccine was delivered on sugar cubes, but in some regions it was stored in small glass ampules that could be strung together like a necklace. This vaccine necklace was not only a practical way for healthcare workers to carry doses into remote areas, but also served as a striking symbol of the global effort to eradicate polio. The necklace helped to make vaccination campaigns easier to implement in resource limited areas, eventually contributing to the near eradication of the disease worldwide. It's a quirky yet powerful reminder of how science and creativity come together to save lives. Story 22. I have painful leg moving toe syndrome. Painless, not true. There are 76 cases known of the painful version worldwide and less than 6 of the painless one I have. My right big toe and second toe almost never stop moving. When it first started, it rubbed all the skin off, but it's built up and just hurts a lot. The muscles hurt too, and my leg and foot contort since it started. My other foot toes have started to move too, which is really common. They don't know the cause or a cure, may something with the spine. I was diagnosed by a movement disorder specialist at the Cleveland Clinic. No self diagnosis. I have so many worse ones, but that is unique. Story 23. So I've known about this since I was 6, so it feels like common knowledge to me. But most people apparently don't know what the aorta is. If you don't know, it's like the main artery, and it sits right above your heart and runs through your whole body. Sometimes, very rare and normally has genetic contributions to it happening, the aorta can just explode. It's called an aortic dissection, and very few people survive it. This happened to my mom, she survived, and my great grandfather and his grandfather both died from it. The thing that always confuses new doctors for her is the fact that she was 35 when it happened. The normal age range for aortic dissection is 65 to 70 plus. She was half of that. She was also forced to sit in the ER waiting room for 7 hours as it was happening because they didn't believe her when she said she was having 10 out of 10 pain. She dissected all the way through her legs and was legally dead for 45 minutes during her 18-hour surgery and was placed in a coma for 3 days after. So yeah, sometimes your aorta can pull an appendix move and just decide to pop. It's pretty much a death sentence. And I can't remember the statistics off the top of my head for survival, but they're insanely low. Story 24. Your insides are more mobile than you think. I've learned a few of these as a patient. Your spinal cord is hanging loose inside your bones, and it moves with you as you move. If not, you have a potentially major medical problem. Your airway moves too. If you put a couple fingers lightly on your Adam's apple and take a deep breath from your belly and diaphragm, you'll feel it move down. This has a name, but I forget it. If you chronically have trouble getting enough air to talk, your body will compensate by clenching throat and chest muscles to compress the airway, to try to keep your voice at your normal tones and volume, etc. Okay, these weren't as wild as some, but I'm always intrigued by these subtleties that keep us functional and comfortable, or not, in our body. Story 25. Your spleen is a combat organ. You may have thought to yourself, How do people who lose entire limbs just keep walking and moving? Shouldn't their blood pressure drop to nothing? Well, your spleen can detect your blood pressure dropping if you've been wounded enough to catastrophically damage your circulatory system. And it has like 3 or 4 blood bags worth of blood that's supercharged with white blood cells and platelets. It gently squeezes itself to press the blood into your system, like refilling a cup that has a hole in its bottom so it doesn't run out. It doesn't sound like this is too helpful, but for the organ to be so developed, it must have helped countless fatal wounds just be life threatening. And remember, it's all about blood oxygen. A human being can be killed unless you destroy its brain, so the spleen essentially tries to give you a few minutes of Uber. Story 26. Your genes for a big beard also mean you're going to go bald earlier. The human mind has developed an instinctual fear of knives and has what I like to call the good stick and good rock instinct. If you pick up a solid stick of adequate length for, say, a spear or tool, your brain will give you a small hit of dopamine. The same goes for stones. Your mind can convince you a part of you is disabled, and as such, you're actually going to be disabled. People have forgotten they're blind with Alzheimer's and seen for a short period. Your memories are just stories your brain tells itself over and over. Human meat is apparently addictive to a small extent. We have no clue why we yawn. Animals avoid humans because of our pale skin and body structure and posture. A deer or wolf will likely run away because they see you as a tall, bipedal, deformed, and flat-faced sick animal. Story 27. Migraines aren't just really bad headaches. My roommate from college started having intervals of sudden blindness seemingly out of nowhere. It was very scary for her, and she had every test under the sun to look for what was causing it. She got a clean bill of health, but no answers as to what was causing the blindness. After seeing multiple doctors, one finally hypothesized that she was having chronic migraines, but only experiencing one symptom. Pain and light sound sensitivity are commonly associated with migraines, but disruption of vision is also not unheard of. She had not had pain or any sensitivity, so the possibility of migraines never entered their minds. The doctor treated her for migraines. I can't remember what that treatment was exactly, but last I heard it worked. Wild.